again and welcome to part 2 of our program. You will see Graham again, Pat and other actors to make your learning experience fun and enjoyable as much as it can be.
Infection control in first aid. You need to check any bleeding and check your own injuries. You need to remove any contaminated clothing and dispose of them adequately. You need to wash your hands. You need to turn your face away from the victim to avoid droplet exposure. And if possible, always wear gloves. Anaphylaxis. Anaphylaxis is a severe form of allergy. Most common allergies are peanut allergies, seafood allergies, and nuts of all kinds, eggs. When people know they've got anaphylaxis, they'll usually carry around with them an EpiPen, which has got a medication in which will relieve their anaphylactic shock. If they do, you need to get hold of the pen, push it up against the leg, and it will automatically inject the medication into their leg. Asthma. Asthma is an inflammation of the airways. It's caused by things as pollen, cats, dogs, and cold weather. If somebody's having an asthma attack, they'll be very short of breath, they'll be coughing, they'll be wheezing, and they'll be panicking. So what you need to do is you need to help them take their medication. Usually comes in a blue container. They may also have other medications on them, which will be grey or brown. These are not for use in an acute asthma attack. They're actually to prevent people from having asthma attacks. Abdominal injuries occur below the rib cage and above the pelvis. Some of the signs you may see in somebody who has an abdominal injury are severe pain across their abdomen, nausea and vomiting. They may go into hypovolemic shock. There could be bleeding from an open wound, and there could be bruising. First aid for abdominal injuries is to put the patient in a comfortable position, control any bleeding, if possible with a sterile dressing, call for help. Stay with them until help arrives and make sure they have nothing to eat, drink or smoke.
And where you at? I got to stop. Just be quick, alright? What are you looking at, old man?
What's going on? Something fish.
What's going on, eh? What's going on?
Take it easy, mate. Settle down. Come on.
Are you alright?
Oh, no, I've been stabbed.
Call an ambulance.
Stabbings and external injuries. It's most important that you never remove any penetrating object and you never apply pressure to a penetrating object. You need to cover the wound with a padding and a non-stick dressing to control bleeding. Keep the victim calm, and if the injury is on a limb, elevate the limb. Nosebleeds. If somebody has a nosebleed, get them to sit upright with their head forward and to pinch the soft part of their nose for about 10 minutes. Once the bleeding has stopped, you can apply ice to the back of the neck and keep the victim calm, and advise them not to pick their nose or blow their nose for a couple of hours. Crush injuries are compression of large muscle by a large object. If possible, remove the object to help prevent further damage and to control bleeding. Call for help and stay with the victim and treat for shock. Shock. Shock is the body's reaction to stress or injury or to an excessive blood loss. Some of the signs that somebody is in shock is they'll have cold, clammy skin. They'll have a weak, rapid pulse. They'll have nausea and vomiting. They'll have confusion, and they could fall unconscious. What we need to do is stay with the victim and call for help and keep them warm.
Oh! I'm on fire! I'm on fire! Oh! 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 Oh!
Burns and scalds can be caused by open flames, by burning liquids, from chemicals, and from radiation. There's 3 types of thicknesses. We have the superficial, which will just cause a reddening of the skin. Partial thickness includes a bit deeper layer and will usually blister, and full thickness burns will cause blackening around the skin. First aid for burns. You need to cool the injured area with cool running water. Treat the victim for shock. If possible, apply sterile dressing to the area. Do not remove any skin. Do not use ice or ice water, and do not apply any creams, lotions or ointments. Bites and stings, spiders and snakes. You need to keep the victim at rest. If they're bitten on a limb, wrap the limb up with a bandage and a splint to decrease the amount of circulation. Do not elevate the limb. Call for help by dialing 000 or 112, and you need to be able to identify the snake or the spider for the appropriate antivenom to be given. Redback spiders, bees and wasps. Apply a cold compress, raise the bitten area and seek medical advice. Marine bites and stings, including box jellyfish. So prevent the victim from rubbing the area. Flood the area with vinegar. Call for help by dialing 000 or 112. Apply an ice pack and keep the victim comfortable until help arrives. Blue-ringed octopus and cone shell stings. So again, apply vinegar to the area and be prepared to commence CPR if necessary, as the sting could cause some muscle paralysis, which can last up to 48 hours. Cat and dog bites. These have the potential for infection, so you need to seek medical advice. Find out when the last time the victim had a tetanus injection. Clean minor wounds with soapy water and antiseptic solution, and apply protective dressing.
So what happened to you, mate?
You wouldn't read about it. I was mowing the lawn.
I've got a stone stuck in my shoe. Marie thought I was being electrocuted. She hit me over there with a cricket bat. Gave me a concussion.
No way! Oh, unbelievable.
Yes,
Cheers to that.
Electric shock. Do not touch the victim until it's safe, as the human body will conduct electricity and you will also get a shock yourself. Check the area for water. Disconnect any small appliances from the power source. Check your victim for burns and cool the injury. If necessary, commence CPR and call for help by dialing 000 or 112.
I must practice for tonight's show. It's been some time. See if I can still get the old tricks. Oh yeah. Oh, almost. Okay. Starting to come back now. Ah, how's that? Okay, it's all coming back to me now.
Choking. Choking is caused by an obstruction of the airways from trauma or by inhaling a foreign object. Some of the signs your victim will show is they'll be coughing, they'll be wheezing, struggling to breathe, struggling to speak or to cry, and they'll be holding onto their throat. If they're conscious, you need to give 5 blows onto the back between the shoulder blades with the heel of your hand. If they're not breathing, you need to give 5 chest thrusts. Do this by placing one hand over the lower part of the breastbone and the same place at the back and push them forward. Check in between and continue doing this until help arrives. If the choking victim is a baby, you need to place the baby face down over your knee and give 5 blows to the back. Place the baby facing forward and give 5 chest thrusts with 2 fingers. Check for breathing. Never use backflows, chest thrusts or CPR on a person who is able to breathe, speak or cough. Convulsions and seizures. Convulsions in children are usually due to infection or poor temperature control. Seizures can happen at any age due to abnormal electrical discharge in the brain, causing twitching, jerking of limbs, loss of consciousness, incontinence and foaming at the mouth. What we need to do is remove danger from the victim and stay with them. Do not move or restrain the victim or give any foods or drinks until fully conscious. Febrile convulsions. Febrile convulsions can occur in children when they have a very high temperature, so we need to protect the child from danger. So remove any clothing and allow the body to cool down. When the convulsion has ceased, roll the child onto their side. Do not bathe the child in cold water or use a fan to cool them down, and always seek medical advice. So care of the victim post-seizure. Cover them up with a blanket. Allow the victim to rest and sleep until they're recovered. Check if they've got a medical alert bracelet on. If they have and they're on a known epileptic, there's no need to call for an ambulance. So stay with the victim and reassure them. Advise them not to drive or operate any machinery and seek medical advice if necessary.
I'll drink to that. I'll drink to that. I reckon there's always one good scent to the weekend. The crows can still lose, eh?
That's right, yeah.
Drink to that.
I'll drink to that.
Drink.
I'll tell you one thing though. Westhoff had his chance. He had his balls coming in 15 metres from the centre, and he's up, he's looking around, he's staggering, and he's going, I've got it, I've got it, I've got it, I've got it.
Drug and alcohol overdose. Some of the signs will be drowsiness, a loss of coordination, collapse, confusion, hallucinations, mood changes, aggression, depression, clammy skin, nausea, vomiting, and they could go into seizures. So what we need to do is assess the victim, identify what drug has been taken, and look for any evidence that may help in treatment. Monitor your victim. If you find any syringe, put it into a strong plastic bag or a glass jar and do not touch the needle. And call for medical help by dialing 000 or 112. If you do get a needle stick injury, what you need to do is wash the area with warm, soapy water. Apply an antiseptic cream and seek medical advice.
Oh, I'm so thirsty. Bit of water. Looks nice. Oh, it's been a long day. Oh, what is that? Oh my goodness, caustic soda. Oh, it's burning. Burning so hard. Oh, that's burning. Oh.
Poisoning. There are various ways that people could get poisoned. By ingestion, through the mouth and the digestive system. If this happens, you need to keep any evidence, such as tablets, berries, any containers that you find. Inhalation. This is when fumes get in through the lungs. So you need to remove the victim from the environment and into fresh air, but you need to avoid breathing the fumes in yourself. Absorption through the skin. So we need to remove any contaminated clothing and wash the area and make sure that you avoid all contact with the chemicals. and by injection. This is by drug abuse, by bites and stings. So the general management is check for safety, check their level of consciousness, and call the Poisons Information Centre on 131126 for more information. Stroke. A stroke happens when an area of the brain is affected by burst blood vessels or a clot in a blood vessel. Some of the signs that the victim will show: they'll have difficulty speaking or understanding, they'll have a headache with nausea, they'll have a loss of vision, sudden blurred vision or decreased vision in one or both eyes. They'll have weakness, numbness and paralysis on one or both sides of the body and face. We need to call 000 or 112 and state the signs and symptoms, as all treatment for strokes has to commence within 2 hours to be effective. Head injuries. Concussion. A concussion occurs after the brain has been shocked violently, resulting in swelling or bleeding and causing increased pressure within the skull. And compression is due to skull fractures, a tumour or infection causing internal pressure on the brain. Some of the signs of head injuries are altered consciousness, nausea, vomiting, a loss of memory, shock, unequal pupils, and loss of balance, hand-eye contact, altered sensation due to one side of the body. Again, we need to call 000 or 112 and stay with the victim and monitor them. Spinal injuries. Spinal injuries affect the neck, the head and the spine due to motor vehicle accidents, a fall from heights or diving into shallow water. So paraplegics is due to an injury from the waist down, and quadriplegia is paralysis from the neck and shoulder due to neck and spine damage. If you suspect a spinal injury, assess your victim. Prevent any forward movement of the head and neck. Maintain the airway is a first priority. So call for help on 000 or 112 and be prepared to commence CPR if necessary. Eye injuries. Eye injuries tend to fall into two categories. We have major injuries and minor injuries. If somebody has a major eye injury, they need to be taken to hospital as soon as possible. If the injury is a penetrating injury and something is stuck in the eye, under no circumstances try to remove it. Instead, pad the eye and cover it up and get the victim to close their unaffected eye to reduce eye movement. With a minor eye injury, it's usually something that's a foreign body that's stuck in the eye. So what we can do is rinse the eye with warm running water. If you can't remove the object in the eye, get the victim to hospital as soon as possible and let the experts deal with it. Fractures and sprains. If somebody has a fracture, which is a broken bone, a broken leg, broken ankle, broken arm, broken collarbone, broken ribs, the best thing you can do is ring for an ambulance and get the victim to hospital. Keep them comfortable and keep them warm. Sprains. The most common form of sprains are on the ankle and on the wrist. The acronym that we use for the treatment of sprains is RICE, which stands for rest, ice, compression and elevation. I'm just going to demonstrate how you actually bandage an ankle that's sprained. Start at the foot. And slowly work your way up the leg. It needs to be nice and firm, but not too tight. Finish off with some tape to secure it. How's that feeling, Michael?
It's fine.
Not too tight? Then we need to elevate the leg and apply ice. It's very important that you don't put the ice pack directly onto the skin, but rather on top of the bandage. Sprained wrists. I'll demonstrate how to do the bandage. We use a smaller bandage for the wrist than we do for the leg, and we start at the wrist. Come around, secure it around the thumb, and then work your way up the arm again in the same figure of 8 bandage. How's that feeling, Michael?
That's fine.
We now need to elevate this arm and apply ice. And the best way to do that is with a sling. To elevate the arm, we're going to use a triangular sling. Now, how to use these slings is you get the point, put it at the elbow, spin the arm down a little bit, you can then get your ice pack and put it inside and rest it over the arm. And just secure this with a safety pin.
Come on, will you? Pick it up. You've been so slow today.
I'm going to the toilet. No, not for ages.
What the hell are you doing in there? Alan, what are you in there?
Hypothermia is a serious medical condition where victim is exposed to cold weather for a prolonged period of time. It will make it worse if the victim is fallen into the river and his clothing is wet. So you have seen Graham. He has been stuck in a freezer for quite a long time, and now he's showing the first signs and symptoms of hypothermia, which is shivering. This victim going confused and unconscious as the internal organs shut down. So how are we going to help Graham? The first priority in hypothermia is to warm up the victim. Anything you can use, sleeping bag, blankets, clothing, shelter, just to make sure that the victim doesn't lose any more heat out of their body. Call an ambulance and medical help and keep the victim warm as much as possible.
Yeah. Whoa, man. You've had a good day, haven't you?
That was a media alert, wasn't it? You're not well. I'll call you an ambulance. Hello, can I have the ambulance?
Diabetes is becoming a new epidemic in developed countries. There are two types of diabetes. Diabetes type 1 is where body doesn't produce any insulin. If there is no insulin, the sugar or glucose can be utilized for energy. Therefore, the treatment for people with type 1 diabetes is injection of insulin for the rest of their life. Type 2 diabetes is where the body produces some insulin, or there is more demand than the body is able to produce. It's usually through lifestyle and also through genetics. Complications for diabetes are hyperglycemia or hypoglycemia. Hyperglycemia is where in the blood there is chronically high levels of sugar. So body starts processing muscle and fat, creating byproduct called ketones, and the danger is that victims can go into ketoacidosis and coma. The signs and symptoms of hyperglycemia are excessive thirst, dry mouth, frequent urination, abdominal pain, nausea, vomiting, and coma. The first aid for hyperglycemia is to call an ambulance. If you suspect that the person is diabetic or the medical bracelet alert indicates that the person is diabetic, you are safe to give sugar, just in case it's hypoglycemia. Never assume that fruity breath on a victim could be alcohol poisoning. With hypoglycemia is sudden drop in blood sugar levels. Normal blood sugar level range from 4 to 6 millimoles per liter. In hypoglycemia, the blood sugar levels go below 4. It is much more sudden and therefore much more dangerous than hyperglycemia. Again, the signs and symptoms is weakness, sweating, irritability, drowsiness. The first aid for hypoglycemia is to give something really sweet immediately if the victim is conscious. Anything would do, like lollies, lemonade, orange juice, even normal sugar you put in your coffee. It's always a good idea if a victim has a medical bracelet alert for diabetes to search their pockets, because people with diabetes are advised and they usually do carry sweets around with them. If a person is unresponsive or unconscious, call an ambulance immediately. Stay with the victim and give them reassurance until the ambulance arrives.
Now you have completed part 1 and part 2. You should have a good understanding of CPR and first aid. If you have answered all your questions, you can now print your certificate. If this program is part of your accredited training, you need to show your certificate to assessor who will physically assess your ability and skills to provide CPR and first aid. I hope you have enjoyed our program and had a different learning experience you will remember for a long time to come. Hi again, I hope you have enjoyed our funny scenarios. I think Graham is absolutely great actor. At the end of the program, you will find a summary lecture which is fully narrated, downloadable and printable, and that lecture includes anatomy and physiology and pathophysiology behind heart attack. So go ahead.